Just ahead, I'll have a conversation with Wendell Potter about all things Medicare Advantage. I'm Mark Harrison. All that and more as Labor This Week begins now. Wendell Potter began his professional life as a reporter and went on to great success in the corporate world, where he worked in the health insurance industry, eventually serving as Cigna Corporation's chief corporate spokesperson. And yet, for all his success, there came a time in his life when he realized that he had become a part of what was wrong. So he left Cigna and began speaking out about how Americans were being misled about all things health insurance, how Congress was being manipulated about all things health insurance, and how the entire system had evolved from a once sacred trust between doctor and patient to a middleman called health insurance. A middleman who increasingly got between doctor and patient in the name of profit and corporate greed. He is a New York Times best-selling author, and his efforts to speak out for reform in our healthcare system have been lauded by the likes of the late Daniel Ellsberg, Bill Moyers, and Michael Moore, to name but a few. Mr. Potter, welcome to our show.
Thank you, Mark. Good to be on the show.
I'm wondering, before we get into any kind of deep questions, I would love to hear, and our audience I'm sure would love to hear, just a little epiphany, a little bit about the epiphany that you had, how that change came about. You made a very drastic change in your life. You went from a corporate, probably comfortable lifestyle to realizing that something was very wrong with the system, and your conscience, I assume, drove you to say, hey, folks, this is broken. How can I fix it?
That's exactly what happened. I've often called what happened to me a crisis of conscience. And it started, you mentioned Michael Moore. I was assigned to fly out to California from Philadelphia, where I live and worked for Cigna at that time, to the first screening of Michael Moore's movie, Sicko. And prior to that, I had been working behind the scenes with my colleagues around the country to develop a communications plan to discredit Michael Moore and the movie, to try to get people to believe that he was out of step with American values, to warn Democrats that they shouldn't get close to Michael Moore because we were going to be labeling him as a socialist, if not a communist. And we had that ready to go. And the first premiere, the first screening of the movie was in Sacramento, and I needed to know how Cigna was being portrayed in the movie, so I flew out there at the company's expense, but ultimately at the expense of those who were paying their premiums for their health insurance. When I was watching the movie in the back row of that theater, I realized that Michael Moore had really gotten it right. He'd spent a lot of time making sure that he was factual, the stories were solid, and I knew with some of those stories because as spokesman and head of communications for Cigna, I was familiar with some of those stories that he was telling in his movie. And I, at times, even teared up because this is a movie that even to this day, I encourage people to see it because it's just as relevant today as it was then. However, it was about a month later when I was back in my office. I was taking some time off and flew down to Tennessee, where I grew up, to visit family. And I read about something in the local newspaper called a healthcare expedition that was being held at a county fairgrounds very close to where I grew up. And I just went there out of curiosity. And I've often said that road to this county fairground was my road to Damascus, because when I got there and walked through the fairground gates, I saw people who were standing in long lines, soaking wet because it had rained, waiting to get care that was being provided free by doctors and nurses who were volunteering their time, and dentists. And I noticed that a lot of those lines led to barns and animal stalls. And it just struck me like a ton of bricks. I knew immediately that I had to take some responsibility for what I was witnessing, because my job was to mislead Americans, mislead policymakers and employers. It was the exact opposite of what I was trying to do when I was in my first career. I was a journalist, a newspaper reporter. And it was just, I was so ashamed of what I was doing, but also heartbroken, because I knew that some of those people in those lines could have been people I grew up with. Could have been me if my parents hadn't been able to save money to send me to college so that I would have a good career. So I made a commitment that eventually, and hopefully sooner rather than later, I would find some other way to earn a living. There were other things that happened. I've often said it was both gradual and sudden. But in early 2008, I turned in my notice and ultimately became an advocate for reform and a whistleblower.
So you're a self-described whistleblower. We were hesitant to use that term.
Yeah, and in fact, I was hesitant to use it myself. I've often thought of that term as a negative. A lot of people view whistleblowers as being people who are ungrateful or have an axe to grind. That was not my case at all. And in many cases, a whistleblower, by a legal definition, is someone who brings a grievance to the federal government that the company that they work for is defrauding the government in some way. That was not what I was doing. It was not a gripe or a grievance against Cigna per se. And by the way, I'd worked for Humana for a few years before Cigna. What I knew was industry-wide. So I pulled the curtains back on how the entire industry operates and how they are motivated by Wall Street's greed, and that those of us who are enrolled in health plans are often at the mercy, frankly, of someone who has the power to determine whether or not we get the care that our doctors say we need, or even the power to allow us to see the doctors of our choice. And that's why this effort to push back against the mayor's determination to move people, the city's retirees, into Medicare Advantage plans is so important to me, because it is those plans are absolutely what most people need to avoid at all cost.
Fascinating story, how you came to us and came to this decision, and we're really glad that you did. You've served a lot of people. I want to, before we get into a big discussion about Medicare Advantage, if you could take us back and give us a little bit about the history of how insurance even came to be entwined in healthcare. Well, about what time did that start? How did it evolve to the point where we are today?
It actually began during the Depression years of the late 20s and early 30s of the 20th century. The hospitals around the country were, people were not going to the hospital. They didn't have money. So an administrator of a hospital in Houston, Texas, at Baylor University Hospital, decided to come up with this idea of selling what became insurance to teachers in the Houston area. And I think it was, maybe I was wrong. I think it was Dallas, actually. Yeah, Baylor's in Dallas. And it turned out to be remarkably successful. He was able to devise this system that's referred to as community rating these days. I don't think it was even referred to by name at that point, but everybody paid the same amount, a relatively small amount, and in return, if they got sick and needed hospital care, they'd be covered in Baylor University Hospital. So that was the beginning of it. About the same time, over in the West Coast, Kaiser Permanente came into existence as the beginning of the HMO movement, and these were plans that back then and even today are pretty good, because Kaiser Permanente owns hospitals and employs physicians, but they also have health benefit plans. So if you're enrolled in a Kaiser plan, you'll be seen by a Kaiser doctor, and if you get sick and need a hospital, you'll be treated in a Kaiser hospital. So those were happening around the same time, and the out of Texas, out of that idea out of Baylor, grew the Blue Cross plans, and then ultimately Blue Shield plans. And Blue Cross plans historically provided coverage for hospital care, and Blue Shield plans provided coverage for physician care and outpatient services. So that was the origin of it. And all of the plans at that time were, again, community rated. They didn't discriminate. Everybody paid the same amount, and the premiums were relatively low. But over time, big insurance companies like the ones that I ultimately worked for saw this as a way to make some money. All of the Blue Cross plans, by the way, initially were nonprofit. But some of the big life insurance companies certainly operate on a for-profit basis, and they smell money. So they began to get into the business of providing coverage to workers, and they essentially destroyed the concept of community rating. They would come into markets and say, we can sell you a policy that's cheaper if you're younger and healthier. And so we began to move into an era in which people were judged, or if not judged, they were determined how much they would have to pay for their coverage based on factors like whether they'd been sick in the past. Pre-existing conditions became something that was very important for insurance companies. And this replaced community rating across the country. And until the Affordable Care Act was passed in 2010, that was how insurance companies rolled. They had the power to declare you uninsurable because of a pre-existing condition, or to drop you from coverage if they wanted to, because you needed expensive care. The Affordable Care Act addressed all of those things, but that's how it began. And frankly, since the Affordable Care Act was passed, we've seen these companies, they can't do some things that should have been made illegal a long time ago, but they've grown even bigger and more powerful and more in our lives than ever before in recent years, as they have merged with each other and gotten more and more into public programs like Medicare, to the point that the health plans that they sell through to employers and to individuals is not what they're looking for these days. They're looking to make money on the Medicare program and the Medicaid program. That is their newest cash cow.
And I assume my next question is, how did we come about to have this Medicare Advantage plan? And is that maybe what you're alluding to? Or to explain that to us, how we went from a traditional Medicare plan, what gap insurance did, and then how this Medicare Advantage program came into being.
Yeah, well, it's important to know that our Medicare program is not even 58 years old. Its birthday will be in late July. But it was a godsend for so many people. Insurance companies back then were not too keen on selling coverage that was affordable to people in their older years, because as we get older, we get more conditions that require more expensive treatment and care and medication. So they were shunning older folks. If they were willing to sell them a policy, it was completely unaffordable for most Americans at that time. So in the mid 60s, finally, there was a groundswell of support for a public program. President Franklin Roosevelt had flirted with the idea of having a national health insurance program in this country. He couldn't pull it off. Neither could Harry Truman. But in the 60s, Lyndon Johnson did pull off something that has been a lifesaver for so many people, obviously with support from members of Congress. He did a lot of arm twisting to get that legislation across the finish line. But a lot of the people who voted against it were Republicans, frankly, and some conservative Democrats who just didn't support the idea of a public program. And many of them began right after that to see, well, okay, it exists. How can we begin to privatize it? And there's always been this belief in America that private companies can do a better job and at less cost than the federal government or government, period. It's not true, but it's something that Americans are very willing to believe, and so as a consequence, lawmakers who were largely more conservative, but on both sides of the political aisle, began to push the notion that seniors should have an option. They should be able to, if they want to, enroll in a Medicare plan that's operated by a private entity. And so that began. Humana, where I worked, it was my first company in the insurance business, really began to market their plans specifically in South Florida to retirees who'd flocked down there, and it became an extraordinarily profitable business for Humana. It was obviously legal at this point. It was called Medicare Plus Choice. But soon the federal government lawmakers decided, well, these companies are making too much money. We're paying them too generously. So they began to crack down on how much they were paying these companies, and a lot of them decided, well, there's no gold in those hills, so they dropped out of the program. Republicans around this time during the George W. Bush administration decided, well, we need to sweeten the pot somewhat to get these private insurers to come back into Medicare. So they created in 2003 the Medicare Advantage program, and it's been off to the races ever since then. These companies have realized there is a ton of money to be made there, and what people need to know is that they operate exactly like private plans. And some people think, well, so what's wrong with that? But it's very, very different from the traditional Medicare program. In a private health insurance plan, these Medicare Advantage plans, they exercise what's referred to or use what's referred to as prior authorization, which is a fancy term that describes what happens when an insurance company bureaucrat decides to interfere in your care and to second guess what your doctor thinks you and pretty much knows what you need. And they restrict your access to doctors as well, too. So the doctor that you've seen for years may not be in your Medicare Advantage network. In traditional Medicare, there are no networks. Almost all doctors and almost all hospitals participate in the Medicare program, the traditional Medicare program. Not so with Medicare Advantage plans. And prior authorization is largely unknown in traditional Medicare.
You brought it up, and I want to go there. So let's go ahead and talk about prior authorization, because that has become such an important thing. In fact, many are saying that it's causing suffering. It is causing death in the extreme. I know there's some stories about a 17-year-old girl, and that was the one that made the media. There's lots of stories about people who are being caused suffering from pre-authorization. Can you take us through what happens when a doctor sits down and requests pre-authorization, and now that goes off to the insurance company? How is that mitigated? How is that decided upon? And how does that eventually come back?
Well, first of all, there are hundreds of conditions that insurance companies look at and implement prior authorization procedures. The 17-year-old girl you mentioned was really the ultimate reason why I left Cigna. She needed a liver transplant. Her doctors had to seek approval for coverage of that transplant in advance because it's quite expensive. And but Cigna said no, and it became a very well publicized case to the point that it became a very big PR problem for Cigna. And I was on the front lines with my team and I, handling calls from reporters all the time. For days and days, and to the point that the executive management of the company decided, well, let's see what we can do to make this go away. And so they reversed course and decided to approve this liver transplant for Nataline Sarkeesian. However, during the space of time, the few days that lapsed between when her doctors first requested this transplant and when the company finally decided it would pay for it, she had gotten sicker, and she died just five hours after Cigna said it would pay for her coverage. That was a very well publicized case, but it goes on day in and day out. Every single hour, there's some case that you never hear about in which someone who needs care that their doctors have recommended, and in many cases begging insurance companies to cover, but they get a denial. And most people don't know what to do, and they eventually die. They die prematurely in many cases, or they think, well, they have no option except to go forward and try to figure out how they can, find the money to pay for something that their insurance company will not pay for. So increasingly, people with insurance go broke. And in many cases die prematurely. That is what is going on, and I'm not sure. I'm speaking very frankly here, but when the Affordable Care Act was being debated, or the bill that became the Affordable Care Act was being debated, there were members of Congress. And you heard this all the time, that what the Obama administration and members of Congress were trying to do was create death panels in the U.S. healthcare system. They existed then, and they're even bigger now, and they are within these big insurance companies. So anyone who is tempted to enroll in a Medicare Advantage plan, and the temptation is very real. These companies advertise lavishly, and their TV ads and their materials make this sound like just an absolute no-brainer. That it'll cost you less. What they do not tell you are the things that are really going to be important for you if and when you get sick. And frankly, it's a when, not an if, for almost all of us.
You touched on the patients don't know what to do when they get back a refusal on their pre-authorization. Do our doctors know what to do? What part are our doctors playing this? Are they up to speed? Are some better than others at doing this? How does that work on that end?
Increasingly you're hearing the term moral injury being applied to healthcare, and in many cases to physicians in particular, because they know what their patients need much more than an unnamed bureaucrat at a big insurance company who will never lay eyes on, much less treat their patients. So they know the drill. They know that they need to advocate for their patients, but it takes time. Either they or someone on their team needs to get on the phone or email, begin the process of trying to persuade some bureaucrat within an insurance company to approve something that they know their patients need. In many cases, they fail, but that's the first action that any doctor should automatically, if he or she feels certain that what he or she is recommending is important, they need to advocate for their patient. Sadly, it requires a pretty substantial staff. It's one of the reasons why healthcare costs keep going up, because doctors and certainly hospitals have to have people on staff who do nothing more day in and day out but to essentially beg for coverage for something that their patients need. So most doctors do this as a service to their patients. It's important, but it's very, very time consuming.
Time consuming. I just read where 45, on average, there are 45 pre-authorizations that go out per week out of any given doctor's office. What is this doing in terms of bogging down our healthcare system? What is this doing in terms of, rather than working on that, a doctor could be having a true patient-doctor relationship with other patients?
Yeah, it is absolutely a death sentence for so many people. And is the reason why we spend as much as we do, or a big reason why we spend as much as we do on healthcare in this country. We spend twice as much on a per capita basis on healthcare as the average of other developed countries. So it's absurd how much money we spend, especially when you consider how little we get in return for so many people, and how restricted access can and often is for so many patients. But that's the way it is, and patients in many cases just don't get the care that they need. One important point is that patients often just take a denial as the last word. That's a final word. No questions asked. They think it's futile to try to push back and to see if an insurance company will change its mind. So it's a very sad situation, and as a consequence of that, patients are leaving money on the table. In other words, insurance companies know that most people don't appeal a denial and don't press their doctors to appeal a denial in many cases. So just a small percentage of denials are ever appealed, and as a consequence, that leaves these companies off the hook to pay for care that they should be paying for, and that once upon a time they did pay for.
Insurance companies are insisting that pre-authorization saves patients money and keeps them safe. Clearly not. But were you ever part of this spin? Were you ever involved in trying to anti-spin this or spin this in favor of the corporation?
Oh, absolutely. And my spin was pretty evident in that case involving Natalie Sarkeesian. I tried to make the case that insurance companies were doing what they were doing to benefit patients, to make sure that they were getting medically necessary, medically appropriate care. That's a selling point, and they've been selling that for a long, long, long time. Now, we know that there are doctors who try to take advantage of insurance companies and over-treat patients, and sometimes that is because patients come in demanding things that they don't really need. So there is at least some semblance of rationale for prior authorization. What has happened is that these companies very quickly caught on to the fact that they can deny things that really are medically necessary, and there won't be much pushback from either, or effective pushback from either doctors or patients. And so that's what's happened. And these companies have ramped up the procedures that require prior authorization and medications as well, too. Keep in mind, we're not talking about just treatments, but in many cases, medications that can save a person's life or keep someone out of the hospital. And allow them to enjoy their lives and have good quality of life. But in many cases, these companies say, no, we're not going to pay for it, because by avoiding paying claims, they're able to keep more and more of what we pay in our premiums, and that they're able to convert to profits. So that's how it began. And it's to the point that a lot of these companies, their prior authorization units are actually profit centers. They sell their services to employers and even other insurance companies. I'm talking about some of the very biggest insurance companies now sell prior authorization services to employers, and they make a tidy sum of money on them. It's become quite a cottage industry.
And that's the major corporations all have sort of sub companies that are doing that, right? That are actually part of the corporation.
Absolutely. Cigna, for example, has a division that it's called Evernorth. Within that is, I think it's Evacor, and it contributes to the company's revenues and profits.
And this not only applies in medical care prescriptions, it also plays it plays into mental health care. That is probably even harder to get pre-authorized. And there's a book written by two Princeton professors called Deaths of Despair. Are you familiar with that?
I certainly am, and I'm certainly familiar with what the book is about. Increasingly, Americans are dying of diseases of despair. It's just a tragic thing that is happening in this country, and it's more prevalent in the U.S. than it is in other countries. And it is because so many people, their lives, they're not happy. In many cases, they're addicted. They have mental health issues. They're surrounded by violence. So there's so many components of that, when you're talking about diseases of despair, that take lives prematurely. And these people in particular certainly need mental health services. And within private insurance plans, certainly Medicare Advantage plans, the availability of mental health practitioners can be very inadequate. You might not be able to get a therapist or a psychiatrist anywhere close to where you live. And many don't accept insurance because we've had this very long history of insurance companies paying mental health clinicians far less than they need to be able to keep the doors open and be able to see patients.
What would your advice be to a patient who gets back a pre-authorization that has been denied, as to how they would go about to continue to fight this? What would your advice be?
Well, essentially, to be a squeaky wheel, or to get someone to be a squeaky wheel for you if you're just not feeling up to it. And obviously, in many cases, this is also something that insurance companies know and take full advantage of. When you're sick, when you've got cancer, when you've got a heart problem, when you've got whatever it might be that's serious, you often do not feel well. And not only are you trying to win the battle with cancer, but you have to win a battle with your insurance company. It's just a horrible, horrible situation. We put people at a time when they're when they're most vulnerable, have less strength and ability to advocate for themselves. It's just an American tragedy, to be honest with you. But you got to do your best, or hopefully there will be someone in your life who will advocate for you. But you've got to be a squeaky wheel, either you or someone close to you, to insist on a review of the denial, file an appeal, get your doctor to file an appeal, go as long as you can. Sometimes the first appeal comes back not in your favor. But you just keep going. You can ask for something called a peer-to-peer review of your case. And what that means is that your doctor should be able to make the case on the phone to a doctor in his or her same specialty. That's not often how it plays out, but that's how it should be. So exhaust your appeal, and if that is not playing out for you, try to get media attention. Reach out to your member of Congress, reach out to your state insurance regulator, reach out to your state lawmaker, your state representative. Do whatever you can, pull all the levers you think might be available to you. And I can assure you that insurance companies, when that begins to happen, they will do like what they did for Natalie Sarkeesian, although sadly far too late. They'll reverse those denials. A high percentage of previously denied treatments are ultimately approved, but most people don't know that or take the time to go through the process.
Words to live by for our viewers. Keep fighting.
Absolutely.
Get up off the canvas. Get into that 12th round if you possibly can. I mean, you're exhausted. You've been fighting this and everything else. You're usually older, but keep fighting.
Yeah.
Thank you for that sage advice, Wendell. How much is the corporatization of our hospital networks playing into this, if at all?
Well, it is contributing. I am the co-producer of a documentary called American Hospitals Healing a Broken System, and it is about how hospitals, and I would argue really in self-defense, have merged with each other to create very large hospital systems, and they've taken a page out of the playbook of the big insurance companies. They know how to make money. And as they get bigger, they have more political clout, they have more money to work with, they can hire more lobbyists, more PR people. So it's a situation that has created even more problems for Americans and contributes to ever escalating prices of care or cost of care in a hospital setting. So it's a problem as well too. Now that's not a blanket indictment of hospitals. At least they do provide services and treatment that we need in many cases, as do drug makers. Insurance companies, not so much.
Can you lend any credence to there being any good things about Medicare Advantage? Is there anything, is there a certain group, income group, age group, health-wise, better health and otherwise? Is there anyone that can benefit from a healthcare advantage plan?
You know, I would say ultimately no, because sooner or later, you're going to pay the piper, or the insurance company is going to deny something that you desperately need to stay alive or to stay well. When you're younger, you don't think about those things. You don't necessarily think about what you might need 5, 10, 20 years down the road. And they market these plans as being better than traditional Medicare because they usually offer some additional benefits, although the quality and value of those benefits are really suspect, and people don't know, for example, whether or not the dental coverage or the hearing coverage or the vision coverage that many of them purport to offer are really valuable. It's something. So a lot of people are lured into these plans with the promise that they can get coverage for things that are not yet covered by traditional Medicare. That's a big problem. What we need to do is improve traditional Medicare to encompass things that happen to us from the neck up. We need to have vision coverage. We need to have dental care and hearing coverage because last I heard, our heads were still part of our bodies. But that's the way it currently is. The insurance companies in particular in recent years have been targeting minority populations, urban areas with high minority populations. If you look at where the highest concentration of Medicare Advantage plans, you'll find them in cities like New York, and they really target minority communities, and I think there are various reasons for that. And these plans, in many cases, are kind of few and far between in rural areas. But they know how to market. They know how to appeal to their target audiences to get them to sign up for these plans.
And what is it that they're doing to convince the unions that this is a good thing for the retirees and to convince cities that this is a good thing for the retirees?
They make the claim that they can save money. And of course, unions sadly have to spend an enormous amount of their time negotiating with employers for health benefits. That shouldn't necessarily be the case, and it's not the case in many other countries. But in the U.S., that's a big reason why unions have membership, and that people support unions, is not just because they're advocating for appropriate wages and wage increases, but for benefits they're better than what they had been, or to try to preserve health benefits. The sad situation is that despite unions being in that game for many years, the value of health insurance has diminished every single year. We're paying more and getting less. But insurance companies, unions are at least presumably on our side to try to make sure that we're getting decent coverage. They often don't succeed in meaningful ways. But I'm going to say this, they're in cahoots with big insurance companies. Big insurance companies will tell unions as well as employers and cities and other municipalities, other governments, that you can save money if you'll just herd your retirees into a Medicare Advantage plan. And it's true. They might be able to shave off some of the cost, but at the expense of the people that are enrolled in these plans. In the case of New York, as an example, the mayors, the administration, the Adams administration is maintaining that by making this move, the city, I think, will save $600 million. That's a lot of money, but it's not really savings as much as it is the money will come from some other pot, and it will come largely from federal taxpayers. There's no such thing really as ultimate savings from these plans to one extent, and the other is that they skimp on providing the care that the retirees need. And that's another way that they save money, and they will deny it to the hilt. But these things that we're talking about, prior authorization in particular, is one of the ways that they save their clients money.
Tell us, if you would, give us a light at the end of the tunnel. As we conclude the interview, I always like to give our folks something to look forward to. How do we get out of this problem? Is it merely by legislating our way out of it? Is there hope? What do you see as a way for healthcare in America to improve instead of continually getting worse?
I'm going to use the same term that I used a few minutes ago about what you need to do for yourself. You need to become a squeaky wheel to make sure you're getting the care you need. We need to become squeaky wheels when it comes to health policy, and to push back against mayors of big cities and our employers that are trying to put us into these plans, to pull off these schemes. We need to protest, and I've just been marveling at the success and the tenacity of the retirees in New York City. That is building. It's being noticed across the country. It's being noticed in Washington. Keep up that work. Keep pushing back. Build that army of resistors. Make sure you're vocal, and show up for rallies. Make phone calls to your members of Congress. Even so-called progressive members of Congress have been misled by insurance companies and have unwittingly been a part of the growth of Medicare Advantage. That's beginning to end. So I am encouraged. There is light at the end of this tunnel. We can change these plans. We may not make them go away entirely, but we can do a lot to fix them and make sure that they do not engage in these practices that are costing people dearly, costing them their lives and their life savings.
Democracy works if it works loud enough and big enough. And the
Absolutely.
other thing they have going is that there's an old adage in Washington, and that is that retired people tend to vote.
Yep.
So they need to make themselves heard, right?
Absolutely. Show up in numbers and be loud and vote.
There it is. Wendell Potter took some time from his Saturday afternoon to join us here at the Labor Network. We thank you very much. Wendell, our self-proclaimed whistleblower, thanks for coming on air today.
My pleasure, Mark. Thank you so much.
My thanks to Wendell Potter for joining us today. If you enjoyed our show, please remember to like us and leave a comment below, as well as subscribing to our channel to keep up with all the latest. I'm Mark Harrison, and I'll see you next week on Labor